And welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, pioneer of the Deuk Piriformis release. It's percutaneous and done with a 4mm incision. This patient has severe piriformis syndrome. Shot? Sure. Shot? Her piriformis muscle attaches to the top of the hip right there, and we're going to go ahead and release it off of the bone, and that's going to hopefully make her feel better. That's the idea, at least. Shot. All right. First thing I need to do is feel the posterior facet of the greater trochanter. It's right there below my tip. Shot. I do feel it right here. It's pretty deep. Shot. Shot. That's it right there. And then turns out you can release this muscle right off the bone. And it's the best treatment for chronic piriformis. Basically, patients who have torn the muscle in their buttock and the problem with the piriformis muscle is that, honestly, it really doesn't do very much, like functionally. You don't need it. It's an external rotator of the hip. Basically, it rotates the hip outwards, and I think I've already released it. I feel it released. It was really tense, and now it's not tense anymore. It's amazing. This procedure is so minimally invasive. See, I could feel the back of the femoral neck there. Shot. I'm right on the back of the femoral neck. And you know you don't need to go any further than that, forward. So the piriformis is behind that. So we're done with this side. Done. And now we'll do the other side. And that was a 4mm incision. Shot. Same thing on the other side. Shot. Perfect. I'm going to make an incision, 4mm, and we're going to go in and again release the muscle off the bone. Now, why is this such an incredible procedure? Well, first of all, the muscle frequently will get inflamed, and it will literally pinch the sciatic nerve, which is what's happening in her case. And as it pinches the sciatic nerve, it causes sciatic pain. Shot. And sciatic pain, if you've ever had it, is horrible. It really, really hurts. And it turns out this muscle attaches to the top of the greater trochanter on both sides and over to the sacrum. And once you've torn it, it's impossible. Almost done. 2 minutes, doctor. 2 minutes. Once you've torn this muscle, it just can't heal. And the reason it can't heal is that every time you get up and move, walk, go from sitting to standing, lying to sitting, lying to standing, anything you do, you use this muscle. I mean, you don't use it, but it gets in the way. It's stretched. Perfect. Once again, the back of the femoral neck. So all activities, all physical activity uses the muscle. Just a few more fibers left.
We have a question.
And let me say, because all physical activity uses the muscle, it can never heal. Imagine trying to heal a muscle that, you hear it? The little pops, yeah, little rubber band snapping. Because to get a muscle to heal, you have to rest it. And unfortunately, there's no way to rest this muscle. All right, we'll take the question. That's it.
This question comes from Shelby on Facebook.
Take a look at these incisions right here, guys. Yeah. Okay. That's it. The whole surgery is done with those one incision per side. We do put a staple because, well, to be honest, it can sometimes ooze a little bit when people are in bed at night moving around, and then they freak out because they lose a drop or two of blood. All right. Yes, I'll take the question. Do we have bandage for this? Thanks.
Shelby on Facebook asked, is this needed if you haven't had much sciatic pain?
Yes, if you have horrible butt pain, even if you don't have sciatic pain. So the reason the piriformis muscle runs from the tailbone over to the top of the hip. It runs right through here. And the people that tear it, they keep tearing it. The sciatic nerve runs through it down your leg, but in a lot of patients, they don't get the sciatic symptoms. They just have the horrible pain right here in their butt. And that's how I figure out they have this problem, is I push right there, and they say, ah! And if you have that, you have piriformis, and the best treatment is to do what we just did. It's a Deuk piriformis release. We do it, I pioneered it myself. The release was done first by other surgeons, orthopedic surgeons, but to do it minimally invasive, percutaneously, we were the first to do it in the world. And we've done it now in 20 patients, and every one of them has had 100% of their piriformis pain gone permanently. All right, great job, everyone. Any other questions?
No current questions.
Thanks for joining us. So yes, you can get your piriformis muscle fix here, even if you don't have sciatic symptoms or radicular symptoms. Thanks for joining us. We'll be back for one more surgery soon.